Arogya pledges to provide a lot of features that are not available in the current market. Arogya offers three initial options. The panic button is an optional direction that is predefined by the patient. For example, a patient who knows he is at risk of having a heart attack can have an emergency contact, a doctor, a relative or a friend with a predefined audio message. The patient needs only a click, and the message is sent to the emergency contact and the panic button calls an ambulance. Another functionality is a primary diagnosis based on symptoms only. Since this provides the treatment options simply based on the symptoms, it nullifies the need for the patient to have any medical knowledge about his disease. It also reduces the first consultation starters required for a diagnosis. Arogya will use its databases to search diseases based on the symptoms entered and map it with nurses who provide solutions to these diseases. Since Arogya analyzes the symptoms and gives treatment suggestions accordingly, Infosys would not have to maintain any doctors. It simply needs to maintain a primary classification of diseases on the basis of symptoms, which is easily available, and maintain a data repository for which doctor treats which diseases. Arogya would also reject any responsibility by giving a list of medical caregivers who treat symptoms and not a list of diseases corresponding to those symptoms. Arogya's nurses work in nurse booths. This is a completely new idea. This will reduce the pressure on the doctors and reduce the doctor-patient availability ratio, knowing that India has already a shortage of doctors at around 7 doctors per 10,000 people. It could also reduce the cost of consultation or diagnosis in cases of minor diseases, if you need to take vaccination shots or are suffering from petty issues. A nurse can also recommend a doctor, but the symptom-based system of Arogya can also recommend doctors that are most likely to be able to help the patient. The help functionality can give a directory of nurses and doctors according to their specialties and offer the possibility of making appointments. Both doctors and nurses see the app as a system interface on their computers, whereas the patient sees it as a mobile app. This app is very Indian at its core, recognizing the linguistic wealth of the country. It aims at connecting patients who wish to communicate in their native language to a medical caregiver who speaks it. For instance, Bangalore has many practitioners from all of India. It remains easy to find a Kannada-speaking caregiver, but finding an Assamese-speaking one is a lot harder. This is where Arogya steps in. This multilingual ability is completely scalable and thus makes it fit for future growth and expansion at the national and international level. Patients who wish to consult caregivers from their home can do so by setting an online appointment. This would not interrupt the doctor's working day, as for example, he would have an online appointment at his office between 2 physical appointments. The nurse at her booth would be in the same situation. The physician can give a prescription via the app's secure channel. The nurse can also give recommendations for medicine or a prescription if she's entitled to do so. The app has smart prescription analysis. Arogya uses the prescription data and checks with the registered laboratories, pharmacies and hospitals for the services or medicines prescribed and notifies it to the patient. Arogya charges a booking fee both to the pharmacies, laboratories, hospitals and doctors. The nurses are hired in booths and their salaries are fixed, so Arogya collects the charges for the consultation. The app also has patient search analysis. It will use the data gathered from the patient search directory. For example, a region with less doctor than it needs can be easily detected, and doctors can move there for more business. It can be useful also for hospitals, pharmacies and laboratories. For Arogya's premiere, we will need marketing people who can go and convince hospitals, doctors, pharmacies. This might just be the next big opportunity for Infosys. Arogya.